Welcome back to On the Beat, everyone. I'm your host, Rachel Hurt, and we're in the studio today with Dr. Bethany Hairston of Vitality Dermatology here in Columbus. And we're talking about, well, I'm going to ask a question. And I don't know if anybody's asked you this, but I got to thinking about COVID-related skin issues. Is that something that you've seen or had to treat since COVID started?
Actually, yes. The most common skin condition that I have seen related to COVID is hair loss.
Really?
Yes.
How so?
Well, there's a particular type of hair thinning called telogen effluvium.
Okay.
And it typically occurs in a generalized pattern all over the scalp after a person has had a stress in their life, and that can be an emotional stress or a physical stress like an illness. And so the COVID virus certainly is a stress to the body system.
Sure.
And typically I'm seeing hair thinning about 3 to 6 months after a person has had the virus.
Really?
Yes.
That's really, really interesting. So they have the virus. Obviously, it stresses you out emotionally as well as physically. So I'm sure there's got to be lots of options. How do you recommend treating hair loss?
Yeah, so I basically have a generalized hair thinning program, and so I would recommend it for hereditary hair loss as well as COVID related. My favorite approach is a 4-step program, and I brought all of my products here today.
Okay. Tell me, okay, I see lots of things. So
Yes.
take me from beginning to end. How do you do it on a daily basis?
Yes.
It is daily.
Daily,
Okay.
yes. So typically there are 2 topical applications. Minoxidil is the morning product
I've
that I
heard of that.
recommend. Yes,
Okay.
and so minoxidil goes directly on the scalp. I brought the product Keranique, that's just one brand of minoxidil.
Okay.
And then in the evening, there's also a topical product that I recommend. It's in the Nutrafol line of products, and it's an ashwagandha, more of a botanical extract. And
Oh.
so that's what's in the little vial there.
Okay.
I have a patient take a supplement. Mainly biotin is the main ingredient when we're trying to stimulate new hair growth. Nutrafol is a brand that I recommend, so I brought the vitamin pack. And then the 4th step is collagen powder. There are Nutrafol brand, there's a nice brand called Vital Proteins, it's off Amazon. You can also find it at local stores. And so the collagen powder, I have a person put into a hot beverage like a coffee or a tea, or even drop a scoop into a smoothie.
Oh, so that's easy. Not
Yes.
too many steps, and it's all stuff you're already doing anyway, right?
Yes, pretty much.
Huh. Well, okay, so I saw on Instagram not too long ago, I think you did a video tutorial on how this process works. Is
Yes,
that right?
I did. I actually had all the products and went through the 4 steps demonstrating how I use them, because I'm actually on this regimen myself, and I've really been pleased with the results,
That's great.
both for me and for my patients.
That's wonderful.
Yeah.
Now, how can we follow you on Instagram?
But we actually have a couple of Instagrams. We have the Vitality Dermatology, and that's where the hair video is.
Okay.
And then I also have my own Dr. B Vitality.
Okay.
So-
Well, I admit I follow y'all and I see all the videos and information that y'all share. It is a wonderful resource if you have questions and demonstrations that you all do. So if you're not following them on Instagram now, you should be. Well, this is really exciting. You know, I never would have thought about the stress that COVID causes on your body, and it's got to come out someplace.
Yes.
So
But we don't just have to let it fall out. We can absolutely work on it. So
That's great.
4-step program.
that is great. Well, I cannot wait to see how this continues to go.
Yep.
Wonderful. Well, if you have any questions about hair loss, hereditary or COVID related, please give Dr. Hairston and her staff at Vitality Dermatology a call. All the information is up on the screen. We'll be back after this short break.